Hi, I'm Carol Standing. It's great to be with you today. I have a question for you. Do you know your health numbers? As business owners or managers of teams and departments, we typically know our business numbers, but do we know our health numbers? And one key number I would urge us all to know is our hormone levels. Now, typically, when we think about hormone levels in decline, we think about women, we think about menopause, perimenopause. But actually, hormone decline affects both genders. It's just with men, it's perhaps more gradual and starts earlier than they realise. Now, in women, during perimenopause, it's estrogen and progesterone that typically starts to decline. That's normally early to mid 40s, and that can affect sleep, mood, cognition, metabolism, brain density, bone density. We know all of those things. In men, testosterone declines at approximately 1 to 2% per year from around the age of 40. And up to 39% of men by the age of 45 can have clinically low levels of testosterone. And that's associated with reduced fertility, cardiovascular risk, mood disturbance, and just an impaired quality of life. So poor sleep, chronic stress. And that's been recognised in research as recently as last year. Now, poor sleep actually lowers testosterone, which raises cortisol, which makes sleep worse, which lowers testosterone further. So you can see that men, as their hormones decline, get into this vicious downward cycle that affects sleep and their overall health levels. For women, we know that their sleep architecture is affected, less deep sleep, early wakening, and poorer recovery, which is where you wake up these brain fogs, etc. So that's rather a grim picture, isn't it? And I don't want to scare anyone, but all of these levels are manageable. But with anything, as in with your business, if you don't know the numbers, you can't do anything about it. So I would urge you today to go and get your hormone levels tested. You can talk to your GP, you can have it done privately. Look for a regulated clinic if you're going to have it done privately. Make sure it's a venous draw. That's much more effective than finger prick or anything else that's offered. But so my urge to you today is all of this is manageable. You can do something about all of this, but if you don't know your numbers to begin with, then clearly you can't. So my message to you today is go and book that hormone test. I wish you a great day.